USAID Bolivia Health Office has been working for 5 years in the Integrated Network of Obstetrical and Neonatal Healthcare Program, in coordination with the Ministry of Health and Sports. The Integrated Network of Obstetrical and Neonatal Healthcare Program is working on the consolidation of 10 health networks at 4 departments of Bolivia, and its activity is based on the SAFSI health policy, community and intercultural family health, that articulates communities, health services, network, and municipalities. Following, there is a simulation sample that offers a response to an obstetrical emergency. This is based on the methodology implemented by the program throughout its partner projects. In the lowlands regions of Bolivia, we find the Beni department, and within the Baliban province and the Rurrenabaque municipality, with a population of 70,000 people. 10 kilometers from Rurrenabaque, we can find the community of Puerto Yumani, which is very close to the river, making this community vulnerable to flooding, especially during intense rainy seasons. Close to 50 families live here with almost non-existent basic services. They do not have electricity, drinking water, or sewage systems. They communicate using cell phones. The road that gives access to the community is in a very bad condition. Thus, during great part of the year, it becomes really difficult to have access to the community. The plan for timely care and care for emergencies offers a detailed, step-by-step sequence about what to do in case of emergency and who will be responsible for each task.
Yo estaba ayer en el Chaco y mi mujer ha estado ahí lavando, de ahí se ha resbalado. Y ella está de 3 meses y está con hemorragia.
Hay que colaborar, hay que sacarlo
al hospital.
Claro.
Que dicen compañeros, tenemos que ayudarle porque él solo no va a poder.
Compañera está mal, dice, ha tenido una hemorragia, a ver, fíjense, hay que acomodar rápido.
Estoy bien mal.
Ya sea de emergencia lo vamos a llevar, entonces estamos pidiendo todos los documentos para que nos ayuden.
Por eso, en el suelo le hayan bajado la mata, pues.
Ay, ay, ay. Cuidado, cuidado.
Ay, ay, ay.
Doctor, tenemos una emergencia acá en Puerto Yumani. No sé si puede venir la ambulancia hasta donde pueda.
Ay, ay, ay. Ay, ay, ay.
To assess the service capacity of a hospital when facing an obstetrical emergency, a simulation is applied to check the corresponding quality standards. The quality standards consist of a set of checking lists for all the processes that should be in place to guarantee the quality of care. These are part of monitoring methodology based on standards developed and implemented by the Program of Health Network Strengthening. Throughout this simulation, we find out that the Puerto Yumani community is well prepared to offer a good response when facing an emergency, and that the Rurrenabaque Hospital has the adequate service capacity to care for an obstetrical emergency. Hipólito Humano, president of the Municipal Health Council, said, "I thought health was the responsibility of physicians, but I understand now. They cannot do everything. Health is everyone's responsibility. It's a priority for the municipality to strengthen the health sector. Now, with Municipal Social Health Council, as part of the implementers of the SAFSI model, the Intercultural Family Health Community model, the application and the improvement on health has become a reality. Before, the municipalities did not know about the model. The community finds the means to organize themselves. I've been told that there was not an emergency plan in place, but I believe that with the recommendation given to us, we can improve, and then we will have another simulation in 3 or 4 months to assess and improve the process. It is expected that deficiencies now can be straightened up and taken care of by those stakeholders who have a responsibility over health management, and when required, they can take demands into account for the processes of municipal participatory planning in health, and include those demands in the annual operative plan. All this process is supported by the Health Network Strengthening Program. The simulation allowed to articulate and integrate health projects that carry out activities at the community level, to set up the emergency obstetrical and neonatal networks at the local level.